Ladies and gentlemen, welcome to the Medfield Town Hall for the annual State of the State, State of the Town, State of the World presentation from Representative Garlick, who is the representative from the 13th Norfolk District. And if I sound like I know what I'm talking about, I just went in and looked it up in the book. So precincts 1 and 2, so she represents half the town, but she really represents the whole town because she's done a wonderful job as our representative now in her 6th year, I believe it is, and hopefully for many more years to come. The size of the crowd tonight, I think maybe she's contemplating running for higher office. I haven't heard of any suggested vice presidential nominees, so maybe you're online for that. But Denise works very hard on our behalf. Since she's been here, she really did wonders in pushing the state hospital land purchase through, and that took many, many, many years to accomplish, and we got it, I think, just in the nick of time, just before a change in administration when we might have had to start all over again. But I'm going to keep my remarks brief. I've already talked much too long. She has much more important things to tell you. So, Denise, welcome to Medfield, and thanks for all you do for us.
So I want to say thank you to Mike. In the 6 years that Mike and I have been working together, you may know that he is one of the longest-serving town administrators in the Commonwealth. His knowledge, historical, as well as what the future should look like, is great. And his friendship is warm and genuine and deeply appreciated, Mike. So thank you. Thank you. Yeah. So I'm hoping at some point Alex is here from Medfield Cable Television, that she can show this wonderful group of people that are here. And the beauty of this group is that we span all age groups. And I am particularly heartwarmed by the young people that are in this room. We have scouts, many of whom I am hoping are aspiring Eagle Scouts. And we have young women in the town that are working on a public policy issue with my office and are showing great leadership at a very young age. So we hear oftentimes today that there is cynicism about how the country is moving and how the world looks. And I want you to know that I never, ever feel cynical about our country or about our world. And it's because of the young people that I see that are committed and working hard, and the adults that are working heart and soul with them as they're growing and changing, and the people that have built this country that stay committed. And we see it no place better than in Medfield. So congratulations to this beautiful town and all the good work that you're doing. Tonight, I wanted to be sure that we also recognize the people who work so long and hard for you all day long and have taken the time to be here tonight. You know, of course, Mike Sullivan, who is everywhere, and I know he makes pancakes on top of everything else, but all the work that he has done. Our selectmen are here. Mark Fisher is here, and Pete Peterson is here. Our chiefs are here. Chief Kingsbury is here, and Chief Meany is here. I have to say, Ron, one of my all-time favorite people in Medfield, Ron Griffin, is here, who's your veteran service officer and who does tremendous outreach with the seniors in the town as well. And behind the scenes, there's always folks behind the scenes. Evelyn Clark, who is, I believe, the clerk of the works here, and Chris Trioweiler. I'm working on this and working on this. I hear her maiden name was Majors, so I think we ought to go back to that. But Chris has been terrific in all the work my office does, and is still here working tonight. So thank you, Chris. So I wanted to share with you how I'm hoping this night will go. We brought snacks for the reception, and that I will speak to you from 7:30 to 8 o'clock. Amanda Bernardo, who is my chief of staff, is here. I am hoping to get through the presentation by 8 o'clock. If I have not finished, I will nevertheless stop, because the next half hour is the half hour for discussion and your questions, and that is the most vitally important time for me to hear about issues and concerns. That's how we're going to set up the evening, so I will begin. I wanted to say, as in my 6th year, the issue, I was thinking, how do I have a theme for what the last year has been like and the things that I've been doing? And I believe it's the issue around balance. And I was thinking, like all the adults in this room, and I expect the young people too, I'm constantly looking for a balance between my work and my family and how to do that. I represent the 3 towns of the 13th Norfolk, which is Needham, all of Dover, and half of Medfield, and I need to balance my time on those towns and their issues. I need to balance my time within the State House, working on these issues around legislation and budget. I need to balance my time within the State House and the work I do outside of it. So how many people here are also striving for balance on a daily basis? So I join you in that. But I don't do it alone. We have a legislative delegation that represents Medfield. You may know that your other representative is Sean Dooley, and he represents precincts 3 and 4, and our senator for this town is Senator Jim Timilty. And I'm very pleased to say that the delegation is strong, likes each other, works well, brings home good results for Medfield, and that is one of the strengths that I have in looking for balance, is I have good colleagues that I'm working with. The next issue that I want to talk about is, as we're trying to balance this, what are Massachusetts' strengths, right? I always want to start with the ability to talk about what it is that we're doing well, that are our strengths, and then what are the things that I want to strengthen. One of the things in Massachusetts is, and a tip of the hat to Ron Griffin, Massachusetts ranks first in the nation in veteran services and benefits of any other state in the nation, and that is something of which I am very proud. We rank first in the nation on our nationally in energy efficiency for the past 4 years. Massachusetts is doing a good job with that. We're going to talk about that a little bit more. We have ranked for more than 8 years, we have ranked number 1 in public education. This is an issue that's constantly on our minds. It is the constant conversation in Medfield around education. When I served as the vice chair of the Joint Committee on Education, there is great initiatives in Massachusetts around that issue. There's also great consternation, and we'll talk about that a little bit. We rank number 1 in life sciences, and I love to say this not only because I'm married to a man who's engaged in life sciences, but because it's not California and it's not other areas in the nation. It is Massachusetts, and we're number 1 in life sciences because our students are so well educated. Our colleges can educate people who then want to stay in Massachusetts. And they want to stay in Massachusetts because we rank number 1 in public education. And as they start their families, this is where they want to be. So tremendous strength on that. And we also, if we'd back up for 1 second, we also rank number 1, and we'll talk about this a little bit if you want to talk about substance abuse. We were the first state to make sure that insurers could not charge more money for making drugs less available to being abused by people. You know that drugs couldn't be split, that there were kind of coding on drugs, and when society said that we needed that, insurers wanted to charge more money for that, and we said no to that. The next thing is, so what are the areas we want to strengthen? And we'll talk about that in terms of, it's certainly education and energy. We want to talk about transportation, and we want to talk about the issues related to energy. And those are the top issues that we're discussing presently. The projector's overheated. This happens. So, but I am not. I'm cool, and we'll carry on. We will carry on. What I will do is just pull out my little notes so I don't go off track too much while the projector cools off. So as we talk about those areas that we want to have strengthened, I think that's a nice way for us to talk about things. Massachusetts is very strong. I'm proud to represent Medfield. I am proud to be a resident of Massachusetts. We have issues we need to work on, absolutely, but we are working on those issues. When we talk about balance, one of the things I wanted to share with you is in the year 2016, I was appointed to be the chair of the Joint Committee on Elder Affairs. What that did for me was two things. Number one, it gave me an opportunity to deal with people all over the Commonwealth. Secondly, as those of you who might remember from my early years, as your representative, I only had one staff person. Well, now I have a full staff. So we have legal counsel, we have a legal researcher, we have a legislative aide. Morgan Pruden is here tonight, who's the legislative aide. We have the ability to bring in interns, and Allie is here, who is a Barbara Lee intern. We have a receptionist, and we have a project manager. So that improves my ability to be effective for the town of Medfield. The second thing is that it allows me to deal with a large swath of representatives. So not only do I have a committee that can do the work, but I have outreach to other representatives, and the way I do that is through caucuses. And a caucus is representatives with a shared interest who come together. And some of the caucuses, and I actually serve on many, but some of the caucuses are concerned, it's the Metro West Caucus. I'm actually on the Manufacturing Caucus and concerned about small business and manufacturing out here in the Metro West area. I serve on a Prevention Caucus and an Oral Health Caucus because you might remember that I'm a registered nurse and I feel like I can bring some strength and input to those groups. I serve on a caucus that is concerned with individuals of developmental disabilities. And in my life, I'm the mom of 4 children. My second child, my daughter Beth, was born with developmental disabilities. And in my experience, not only with Beth, but as a nurse, I was the nurse at Charles River Center for a period of time dealing with adults with developmental disabilities who are medically fragile. So when I serve on those caucus with other representatives, I feel like I can bring my heart and my hands to that kind of work. And I serve on a caucus that deals with the issues around oral health. So, a good amount of those issues that are concerned with health. And that's a tremendous strength for me to be with different groups. If we looked at this whole room and all of you got together for one issue and then you mixed it up and you met new people and you dealt with the other, you really can build strong relationships and move issues. So the second thing is that, and I introduced the staff a little bit in their staff pitches, I did that so that you know that when you call the office, these are the faces of the people that you're going to speak to. And they are very committed to the district. And Morgan, as a relatively new legislative aide, was an intern first. She knows Medfield well, and she's come to love Medfield just like I do. So then the issue around the balance is, I think of my work in these 3 buckets. You know, the budget, legislation certainly, but most importantly is constituent services. We have more than 40,000 constituents in the town, in the district, and those issues, I consider the constituent individuals who call, like Kate and Rachel, who are right here, and are dealing with an issue. I consider it to be groups like the Medfield State Hospital Property Planning Group that's meeting, and God bless you all for all the work that's ahead of you, and with the town. And I consider Mike as the voice of the town and a major constituent bringing forward issues. And I'm constantly looking for balance. What you're going to hear right now is a tremendous talk about budget. And because this is budget time, so that will dominate the news. You know, this will tip towards the budget. We'll tip back towards legislation as we get into July, but it's always the constituent issues that drive the work that I do. So what are those constituent issues? I'm going to list these here and just give you some examples. I'm hoping on the list that you will see an issue or concern that's important to you. And I hope you know that I hold district hours in Medfield at the Medfield Library. And it is a major priority for me to be the person who's there. That doesn't happen 100% of the time, but it happens most of the time. I work on the issue of libraries, and that's another caucus that I'm in. But the Medfield Public Library is particularly important to me because the library has done so much work with adolescents and making sure that's a safe space and a place for teenagers to come. I have to tell you, I don't see that in a lot of libraries in the Commonwealth. I think Medfield is a leader in that kind of model for the libraries. We won't even touch this whole Council on Aging because I'm the chair of Elder Affairs, so I'm thinking about those things a whole lot. The Medfield Cultural Council has been very important to me, and you have Jean Minio is here, a tremendous leader in this town, and through my office we've written a letter in support of a grant for the Cultural Council as we're looking at the Medfield State Hospital properties and how we're going to use that. So here's my scouts. I have to tell you, I told you I was a mom of 4 children. I have 2 daughters, 2 sons. Both of my sons are Eagle Scouts. We've worked hard. I know what that takes. I know why it's important, but I have never seen anything like the way Medfield can grow Eagle Scouts. This is the best place, I think, in the country to be a young man who wants to learn leadership, who wants to be committed to citizenship. From my heart, my compliments to the young people here and the adults who are committed to them. We also have folks here, Roz is here, around the issue. So I grew up in Dedham. I live in Needham. I represent a district that is contiguous with everything I've ever known, right? I mean, we're in one circle. There are 39 horse farms in my district, and I never, ever knew that. And I am amazed by that, and I am thrilled by that, and try to pay attention to that issue. And I have been invited to the fox hunt on the Medfield State Hospital property on Thanksgiving morning. I haven't made that yet, but that's very important to me. And I know that Pete is here, the Medfield Foundation. I think a day that captures the spirit of Medfield is that Volunteer Recognition Day, just a wonderful day. So I want you to know these issues, the Medfield State Hospital, Mike had a chance to tell you that I have worked on that, and I have worked hand in hand with Jim Timilty, who has worked on that issue for years. And I work hard to make sure that I understand what's happening in the town and attend town meeting. I think if you want to know a town, go to that town meeting and see who shows up and what that discussion is. So one of the things that I just wanted to touch on in the last winter, and I am not going to say anything about so far, this winter looks pretty good because I think I said that last winter just before we got slammed. But one of the things is the town did get assistance through FEMA. And I actually worked with Mike and with your DPW. I actually received calls from individuals in Medfield, particularly around small business concerns, that would be helpful. And we can talk about the issue of the fentanyl when we get to substance abuse. The Act Regulating Secondary Metals Stealings, I actually put this here thinking it might be of interest to Medfield because there is so much building here that's going on. And there is a whole issue about copper being stolen and these metals being stolen and resold. And now we have a way to deal with that through this legislation and the issue on foreclosed properties. There's a turnover in Medfield that's consistent with the turnover in the surrounding towns. But one of the issues around the foreclosed properties was sometimes that title doesn't get clear, and that's not always evident. And then you're in a house you want to sell, and you can't move that because the title isn't clear. So we actually got rid of some of the constraints on that. And this is when I talked to you about the work we have done in protecting our veterans. This was the Valor Act 2, and this was primarily, Valor Act 1 was about providing benefits and education and talking about homelessness. Valor Act 2 was very much about protecting the integrity of the Veterans Service and honoring that. So as we look forward to that year, these are the issues that I said that I believe are going to be coming up. These are the issues we may discuss when we get to the discussion period if you're interested. But we are hearing, the governor gave his State of the State address at the beginning of the week, and these are the issues he was talking about. The Speaker gave an address to the House of Representatives on Wednesday morning, and it is these same issues. So you hear it once, it's interesting. You start to hear it again. I think we've got some momentum on these issues, and this is where we're looking to it. So when we talk about an act relative to substance use treatment, education, and prevention, this is vitally important. And I'm going to skip over those details because I think we'll go back to that, Amanda. When I talked about the budget process, I put this up just so that you know that there are multiple steps in the budget process. And it's, the governor released his budget yesterday. The House will do our budget work in late April. The Senate looks at the budget in late June. We all try and get to agreement by July 31st. Everybody doesn't agree, as you can imagine, so there's a lot of negotiation that goes on those issues. But for Medfield, the money that came back to Medfield, the Chapter 70 money is the money that supports schools. There is concern in Medfield about the foundation formula that has been worked on over the years so much that you can't even follow actually now how that money comes up unless you're devoting your full-time analysis to that. But that issue is important. One of the things I hear from people is that they want very much a review of the foundation formula. I would like a review so that it is more clear how that money comes, but I am very careful about that discussion because I believe that if we rework that formula, that the towns that I represent will not be the beneficiaries when we look at the needs in Haverhill and Brockton and those towns that are under tremendous stress. So this is the money. We try and increase this money. The governor is committed to this money in his budget. The House will be as well, and hopefully able to put some more money there. I also work on the special education circuit breaker, important in every town in the Commonwealth, particularly in my towns, in that there is a formula that when the town has spent a certain amount of money, then they get reimbursed by the state for some of it, but it doesn't come till a year later. So when you hear the strain on the budget, that's what it's about. But the fact that Massachusetts is committed to all their students is one more thing that I think we should be very proud of. We don't pick and choose who we're committed to. We're committed to all of our students. The other issue is around local aid and around Chapter 90 money. So if your town administrator, Mike Sullivan, could have anything he wants in the whole world, it would be just give him the local aid that he needs for the issue he needs in this town. We're seeing more money being given to local aid. Local aid is the money that helps to support your public safety. It helps to support your public works. It helps to avoid those issues, and the unrestricted local aid, the town itself can make some decisions about that money. Chapter 90 money is the money for your roads and bridges. That comes to the town. There has been a commitment by the House of Representatives and most recently by the governor to increase that Chapter 90 money. That's all the discussions you hear about the condition of our roads, the condition of our bridges, what we have to do. So now, for me, for my district concerns, I have people, and I get more calls on the budget from people in my district than I do on legislation. And the calls on the budget are people that understand the work of the state agencies and how that may help their issue, their concern, their initiative. So I work on the suicide prevention line item. And so each line item needs a champion or a caucus of champions for that. You might remember that in Needham, I was the chair, the founder and the chair of the Needham Coalition on Suicide Prevention. So I continue to work on that issue. DDS is developmental disabilities. Always I work on the councils on aging and want to increase that formula. And Amanda told me I have 2 minutes. And I also work on the LGBT Youth Commission work. because that's very important, connected to the work on suicide prevention and on bullying. And looking forward, these are the issues. You know, these are my core issues. These are the issues that I'll work on as we look forward. Okay. This I put up, and I don't want you to think I'm bragging, but I want you to know I'm out there trying to do a really good job, and some people are noticing it. So these are things that have come my way as awards and recognitions. And one of them I wanted to share with you is that the Blue Cross Blue Shield Foundation, I engaged in a 9-month leadership initiative that was very intensive, and I learned a great deal. And I worked with many of the middle managers of community health centers, and that was all through last year. So that was an incredible experience for me. The next thing I wanted to share with you is the way that I want you to be able to connect with me. This is my room number. I know that the young people in this room, Rachel and Kate, know how to connect with me. I want the scouts to connect with me. I can be helpful, I think, to you on your citizenship work, on having you come to the State House, for all of the issues that the people in this room are working on. Please connect with me. And I wanted to share with you that as of tonight, we are launching the 2016 website. So I hope you take a look at it. And to the good people in this room, if you have any feedback for me on that website, I would love to hear that. We've worked hard on it, and I want to know that it works for you. So with that, it is 8 o'clock, and I would love to open this up to discussion. We have some questions on index cards. If you want to ask your question personally, please do. If you are waiting to have it read from the index card, that's also fine with me.
Well, I'm Kate Travis, and first of all, Rachel and I both want to thank you for meeting with us and getting back to us on the subject of child custody for rape survivors. It's really important to us, and thank you for contacting Jane Doe and hopefully writing to the head of the Judiciary Committee. So I was wondering, my question really has 3 parts. When do you expect a bill to be filed by? What do you see as the biggest challenge in passing this legislation, and what can we do to help?
First, I want to introduce everyone to Kate and to Rachel, who are sitting in the room and have taken on this really very important and overwhelming subject around custody for rape victims. But the first thing was, when do I expect that legislation could be filed? So I talked to you about the 2-year legislative cycle. So we're in the middle of the cycle presently. All bills have to be filed by a certain date, and it's usually December before the 2-year cycle begins. There is an opportunity to do a late file of a bill, but unless that issue is so compelling that it would move the process quickly, it's not the best strategy. And the process is, and I think we have it on the computer, the process for legislation is 13 steps. And it's oftentimes people will hear about an issue on WBZ. I wake up in the morning to hear what I'm doing that day, and WBZ is talking about a bill that's pending, and it's actually the public hearing, and that's only the 3rd step, and very early in the process. So I think our best strategy is to file on the appropriate day with the new session. What happens between now and then? Does that mean nothing's happening? What actually happens now, and I was just engaged in this with another representative, is the ability to begin to talk to people and say, gee, I'm interested in this issue. Would you, the chairman of the committee, work on this with me? Would you, the chairman of the committee, ask your researcher and your legal staff to look at this? And we have begun those discussions with the Judiciary Committee, which is who I think will handle that bill. I mean, I'm making an educated guess, but I think it's Judiciary that will handle that. And we have started that discussion and asked for time with the staff. So that's happening. The second part of your question was, what does that process look like? Yeah. So that's the 13 steps. So
the handout over here.
Okay. So we have that as a handout. And the third thing is, what can you do? So you've already done a tremendous job in bringing this to your representatives' attention. The second thing is that you stay involved through the process. And, it's one thing to have a good idea. It's a whole nother thing to stay involved in the process. As it goes to public hearing, we would want either you able to testify personally, or we would want written testimony. We would want you to speak to Representative Dooley, would want you to speak to Senator Timilty, and build that kind of coalition and support. But it's a great process. It's a frustrating process for people because it takes so much time. A bill on average will take between 4 and 5 years to pass. And people are like, what is that about? It's about that kind of deliberation. It's that discussion, that process, and that kind of input. There's lots we have to learn. You and Rachel, Kate, know a lot about the subject. There's a whole lot more we need to know to make sure that a law would reflect our best concerns.
Thank you so much for coming. Osler Peterson. I was at the Mass Municipal Association annual meeting on Friday and Saturday, and on Friday, Governor Baker spoke to everybody, and he announced that he was going to recommend that the state aid for the municipalities was going to rise by the same level as the revenue projections were rising, the 4.3% number. And he also mentioned that last year it had risen 0.75% of that increase. And I know that the MMA has been trying for a long time to get the legislature to do revenue sharing so that the amount of local aid that the towns get is tied to the state revenue. And all of a sudden it dawned on me on Friday when I heard the governor say that he was doing it. In fact, is that what's happening, and is that going to go forward?
So that question for folks that are thinking about what does that mean? So that local aid number that is so important to our municipalities, right? There are revenue meetings that happen in December before the new year in which we bring some of the best minds from across the political spectrum to testify in front of the legislature on what they think the revenues will be for the following year. The low number was 3.8%. I think the high number was somewhere above 4.6, 4.8. And the decision by all parties was that we were looking for a revenue increase in the Commonwealth of 4.3%. Governor Baker then said that he wanted to match that percentage of an increase into local aid. I mean, not all of that revenue, but a 4.3% increase. And in fact, in the budget that the governor released yesterday, that's exactly what we saw. Of all the issues that will change and be discussed as we talk about the governor's budget, the House budget, the Senate budget, I can't believe that local aid number that the governor has proposed will go down. I'm looking directly at Mike Sullivan for some kind of sign, but it seems to me that would be very difficult to do. So I'm hopeful that is the floor. And maybe, there is a lot happening around this revenue issue that's very uncertain. Maybe as we get into April, there's more revenue. And oftentimes, by the time we get to June, the House meets after all the income taxes have come into the state. Usually the outlook is better. By the time we get to June, I'm hopeful that it's going to be much better, and we'll continue those discussions.
Yeah, the Department of Revenue did publish the information town by town this afternoon, and when we were able to get into our computers, I looked it up. It did indeed go up 4.3%. Now, but it is not on the entire local aid we receive. It is just on something called additional assistance.
Okay.
The major local aid we receive is, as you pointed out earlier, Chapter 70, education aid. That, I believe, he increased by 41 million, which was about somewhere around 1.5%. So for the majority of our local aid, it will go up between 1 and 1.5%. On the additional assistance, it will go up 4.3% under his budget anyway.
So I'm not the first person in the Commonwealth to say today, the devil is in the details. The devil's in the details. Amanda, I think John wanted to ask a question.
We have a lot of discussions about housing, both because of the 40B issues that we face in Medfield, but also there's a question about the housing authority land and whether or not the housing authority growth in housing has any significant place in the upcoming budget? I mean, is there money there to add to our Tilden Village, for example?
So it is premature for me to say that, except to share with you, John, that the housing issue is a major issue in the Commonwealth. We are hearing that in certainly in conversations we're having around veterans housing. We haven't built new veterans housing since the 1940s in this Commonwealth. We're hearing it related to seniors. And as we look at the population of seniors increasing, who may want to downsize and stay in their community, which is a discussion I would love to have because I believe so firmly in keeping our seniors in our hometown. We don't have housing for seniors. And the prices in Massachusetts, as I talk to you about how proud I am of Massachusetts, Massachusetts is also expensive. And seniors who might want to, I talked to a woman in West Roxbury. In my role as the chair of Elder Affairs, I am traveling all over the Commonwealth. I have been in 25 representative districts, invited by the representatives to speak to their seniors. So I've spoken to probably, I would say, more than hundreds, and maybe more than 1,000 seniors. And one of a woman in West Roxbury who wanted to downsize from her large Victorian house, she can sell it, but she can't afford the rents in that area. And all of us, and for our young people in the room, I want to tell you, we don't know how to plan anymore. Health has changed, aging has changed. Someone told me 60 is the new 40. My mother-in-law just turned 90, and somebody told her 90 was the new 60. It's hard for us all to plan and what that's going to take, and housing is going to be a major issue. So I know that people are looking carefully at it, John, but I don't know where they're putting their resources just yet. Okay. So, anyone else who'd like a personal question?
We have a whole bunch of index cards too.
So let us look at the index cards. And this is Morgan Pruden, who's the legislative aide. This is the position that Amanda used to have. And I thought nobody could be quite as wonderful as Amanda, but Morgan's pretty darn close.
Okay, the first question is, can we do a fundraiser for a skateboard park?
I'm thinking that that's something that the people in the town of Medfield needs to think about it. So I wanted to say to you, as your state representative, I feel like if we were in an organizational chart, I feel like there's a direct line from Medfield to me. But there's a dotted line from me to Medfield where I am very careful about coming in when I am asked and not jumping in a place that it's not my place to be. I don't know if you'll have a fundraiser or not. If you do, invite me.
Okay, the next question is, how does the process of removing a law differ from the process of creating one?
So that actually is a great question. And I would tell you that the process for removing a law is as complicated as the process of making a law. And that is why I think we are always so careful about what we do. A process for removing the law would still have to go through those 13 steps. It would have to be filed. It would have to have a public hearing. It would be assigned to a committee. It would have to have a public hearing. It would have to then go to a second reading. A public hearing is within the committee that has the law. A second reading is when you notice it to the rest of the House of Representatives, the people that aren't on the committee. A third reading is a heads up, everybody. This law is getting traction. This law is going to come forward for a vote. Then we would then debate that law on the floor, and we would have a discussion about that and a vote. It would then go to the Senate for that same process. So the thing about laws is they're hard to make, they're hard to delete. You have to be careful about what you're doing.
The next question is, what is the latest update on the Medfield Hospital?
So the people in this room are the best experts on what the update is on the Medfield Hospital. You have many people who are working on this issue, and I am patiently waiting for the time that Medfield decides what it is they want to do with that property, and if they need any assistance from me, their state representative from the legislative delegation. But that is an issue that belongs to the people of Medfield, and I trust that you all will make a good decision. I see that it's a very careful process, and I know that there's a lot of people involved. And I know that recently the Medfield State Hospital Planning Committee has decided that at town meeting, they will bring information there, but not a plan. And I actually congratulate them for that. Medfield has an open town meeting, which is a tremendous strength. It's also something that you get people who are connected to an issue who will show at that meeting, and they might not come to other meetings. I suspect we're going to get a lot of people at that Medfield town meeting, and it should be a good discussion.
That's all I have. There.
Okay. So yes.
I thought I would just bring up something I know that was in your presentation that you said you would go back to, and that
Right.
was about substance abuse issue.
Right. So I would love very much to do that. And if Amanda, if you could bring us back to the slide on the bill. So I want to share with you, as a mother of 4 young adults, as a registered nurse, as someone, I have served on the Joint Committee on Public Health, the Joint Committee on Mental Health and Substance Abuse, and the Joint Committee on Healthcare Financing in my experience. This is, without a doubt, the most overwhelming issue that I have seen presented to the legislature on behalf of the people of the Commonwealth. What is happening around the issue of substance abuse in the Commonwealth is devastating the lives of individuals and families, and the numbers are so overwhelming. In my own experience as a legislator, one of the great things that happens is that I get not only to sit in public hearings, which I feel is like a little mini masters, where on a particular subject, the people who support it and the people who are against it all come and tell you exactly what they're thinking. But I also get to visit facilities, and I visited a recovery house for young women, and the story to me is very concerning, because what we're finding now is there's not a long path to substance abuse. There's a very short path to substance abuse because heroin is so available to people. One of the things, our chief, Meany, was here, one of the things that our police chiefs needed was the ability to buy Narcan in bulk. And Narcan is a drug that can reverse the effects of an overdosage. It's not the answer to this issue at all, but it helps in the emergency. It helps in the moment. We know that in the Commonwealth that many people cannot get the care that they need at the time of an emergency incident. In the legislature, we have addressed that issue. We have created new standards in the emergency rooms for how people should be evaluated. One of the things in the House bill that we just voted on was that there was a debate around how many people might know around this 72-hour hold versus would we release people. The 72-hour hold, I actually was very interested in and thought that it could be valuable because I believe anyone who overdoses in that moment in time is a danger to themselves. But the whole issue around the capacity within the Commonwealth hospitals, and if we're just holding people and not delivering care, is that therapeutic? In the House bill, we voted that anyone who comes into an emergency room with an issue of substance abuse has to have a medical evaluation and a plan. But more importantly for me, that plan has to be noted in the record and signed by the provider. And in my long history as a nurse, what that tells me is that there's both responsibility and accountability now for that person. So a 72-hour hold in which the person is released without a plan of care gets them through that immediate period. But we often see people that have overdosed after 72 hours return to the community, use drugs again. They go back to the same place, the same issues, the same concerns. They use drugs again. And that's when a second overdose happens, because now their bodies aren't tolerating the drug because they have a lower level. So I think we've done an important thing in the House bill, But it's different than the Senate bill, and it's different than the governor's bill. So that has to be negotiated. And we'll see how that process ends up. We have done work around the information we're going to have in the public schools and how that's going to be shared. One of the things that I did as the chair of Elder Affairs is I made sure in the House bill, and I'm grateful to my colleagues for this, but in the House bill, we also talk about substance abuse with elders. And we have made sure that the Secretary of Elder Affairs is on this large commission who's going to look at the issue. I think this is important because what we know with our elders is everyone's talking about opioids. You know, I'm not sure we all know what opioids is. I certainly know that I have trouble saying that word. But many of those drugs are being prescribed to seniors, and they might be being prescribed by different doctors. Many of our seniors will believe that because the doctor gave it to them, that that's a good drug. And they don't understand that, in fact, they can overdose. And we also need our seniors to be aware that those drugs in the medicine cabinet, you know, some people are getting their drugs on the street. Many of our young people are getting their drugs in the medicine cabinet in their house or in their grandparents' house. So I'm pleased that we're doing that work around our seniors and recognizing that when we talk about populations of people, that the issues that affect anybody affect our seniors as well. Issues that affect anybody can affect everybody. And I'm always being a consistent voice to talk about our seniors on this issue as well as any other issue. And the other issue is around the prescription monitoring drug program. There is a tremendous push in the Commonwealth by many people, including me, to have physicians note in a database when they have prescribed an opioid drug, and so have that database available so that if a person goes to Milford Hospital and gets a narcotic, and you know we're talking about OxyContin and Percocet and those issues, right? And then in the same day leaves and goes to Norwood Hospital, and then in the same day goes to Beth Israel Deaconess Needham, and that's what people who are drug seeking do. There should be a way that we can record that and that physicians can be alerted to that. And there's some pushback on that, and I'm hoping that discussions will move that issue much further along. So this issue is vitally important to me. So it's actually from the physicians, and they're saying that the database they have is unwieldy and it takes up too much time and they can't be searching back, and I think that the people who believe that they should be doing that in the legislature and the governor are going to say, we appreciate that makes your job harder. We understand that it can be unwieldy, but we will pay, the state is helping to pay to improve the database, but this needs to be done. And I think we're going to see it happen. You know, and I'm respectful of the reasons why people might say it's difficult, but I think the need to do it is much greater. Yeah, and that's the balance issue again, right?
Bill Massaro. Denise, on this same topic, I would hope that when the legislature takes this up, that they also consider the impact on caregivers.
Yes.
We've just gone through about a 2.5-year process with my mother-in-law, who was on opiates for almost 2.5 years. And the caregivers found themselves having to actually go and get prescriptions filled for her and everything else. And on top of the burden of caring for the person, of the in-house care, of taking them through in-house therapy, in-home therapy and everything else, and then to have to leave to run so many days out, you know, back to the hospital to pick up their prescriptions and everything else. I've heard talk about perhaps limiting prescriptions to 3 days worth or something. I would hope that some provisions would be made for caregivers who have to, in fact, leave the home to go to get the prescriptions and leave the person and then come back. So, I mean, it's quite a burden, I think, or it could be quite a burden.
So I think this is a great example. I want to answer your question, Bill, and then I want to talk about how I think it's a great example of a way I can be helpful. So the first thing is that in the House bill, it says that an opioid prescription should only cover 7 days. There are, and I'm doing this from memory, but there are, I believe, 4 million prescriptions were written for opioid medication in the Commonwealth last year, to a total of 200 million pills out there in our Commonwealth, right? So that's where the idea comes that we have to limit the number of these drugs. It is for the first time prescription. And in the House bill, it says 7 days. The first prescription should be 7 days. I believe that's true. The first time you go to a doctor and you need, and I'm drawing on my nursing experience here, but the first time you go to a doctor that you need a pain medication of that kind of strength, there should be another assessment within a week, right? So I support that. But there is an exception for people who have chronic pain, people palliative care, which is comfort measures, and for people that have cancer. And I'm hoping that we will see in the Senate bill that they will adopt that language as well in the negotiations. And I think that's very important. That's a great concern for our seniors. And I said that I wanted to answer your question, then talk about how this could be an example of how it could be helpful. So oftentimes you will hear things on the news, or you will hear things that just don't ring right to you. I want you to please feel free to call the office and say, I'm just looking for some clarity on this. And just like me, you're probably looking for balance, but you want to make sure you have the right information. When you call the office or send us an email, we actually don't get the number of calls I think representatives used to get. What I get is emails, an overwhelming amount of emails. But when we get that email, we can clarify that information for you and get back to you. And we'll do it, either we know that information right away or we'll get that answer for you. And I think that's really important. I think in a day when we're getting so much news on so many subjects, and our news can be biased. So you're hearing a viewpoint, but you might not be hearing the facts. Please feel free to give me a call and ask that question. So it is just a few moments before 8:30. I don't want to keep anyone here past 8:30, but I will stay here for anyone who wants to discuss anything with me personally. And I just want to say thank you. I am so pleased with the people that have come. I am so pleased that Medfield Cable believes that this is worth their time and we'll get this on the air to people who can't come. And I hope, I have always said, you've sent me to do a job, I'm reporting back. I hope you feel that I have accountability and responsibility to all of you that I am representing. And I was thinking today that I wanted to say something other than it's a privilege to serve Medfield. I'm afraid that you hear that phrase a lot, people say that, but there is no better phrase. It is a privilege. I am proud to be representing this town. We may struggle with issues here. Let me tell you, when I get to the State House and I talk about the towns I represent to other representatives, they think that this is just extraordinary. And your strength is your young people and your committed volunteers, all the talent and skill that people bring to town government, and your town government that is so committed and is rooted in today and visionary for tomorrow. And I congratulate you all, and I thank you for the privilege of serving.
Medfield TV.